Good afternoon. County Executive Rich Fitzgerald here for our weekly briefing on the pandemic of COVID-19. I'm also joined here by Dr. Deborah Bogan, our Director of Health here at the Allegheny County Health Department, and also joined by Dr. Weinberg, who's with AHN and the Director of the Division of Geriatrics, and she's going to talk about some of the issues concerning that part of our community. Over the last week, since we last talked, the numbers again in Allegheny County have continued to remain at a relatively flat level. And that is really a credit to all the folks in this region who've continued to listen to our health experts, Dr. Bogan, our friends at AHN, our friends at UPMC, Pitt Med, who have really gotten the word about how we need to continue to social distance. We need to continue physical distance as we socially connect. The mitigation, obviously wearing masks now when you're in certain settings per the directive of Secretary Levine in the State Department of Health. Again, as we say every week and constantly throughout the week, this is a marathon and not a sprint. So we've got to continue. Just because those numbers are good doesn't mean we want to take our foot off the gas and relax and get complacent, because it's something to protect our family and protect our loved ones. We want to continue to do that. We've also this week want to again express our sympathy to the families who've lost loved ones. Our death rate continues to go every day. We lose more folks who succumb to the pandemic, and that is still something obviously we're very concerned about. And our thoughts are with the families and the loved ones who have lost loved ones. You saw earlier this week an announcement by Governor Wolf and his team that have begun to start to loosen up some of the issues and some of the organizations and businesses that are out there. As I've said constantly, we're dealing with two crises. Crisis number one is obviously the health, but crisis number two is the economic impact that it's having on individuals, businesses, in this community. Governor Wolf announced opening up online car sales, which have begun to occur already. The Pennsylvania Liquor Control Board is doing curbside pickup for liquor. And then on May 8th, there's going to be a restart of many construction projects in that industry again. And in each one of these instances, there are many mitigation rules and regulations that have been put out by the Department of Health that they continue to do. In addition, the extension of the stay-at-home order is through May 8th, and I understand the governor's going to be making an announcement later this evening to kind of talk about even more opening that could occur, but it's got to be very, very careful, and we've got to continue to make sure that we stay away from large crowds, we physical distance, and we do all the things that we've been talking about since we did the emergency order back on March the 13th. So with that, I want to introduce again Dr. Bogan, and I can't say enough about her and her team and the work that they have done to continue to contact trace the testing that's going on, the recommendations, staying in constant communication with the CDC, with the NIH, with Secretary of Health Levine, and the entire team. So again, I want to thank her and her team that have just really kept us safe and kept us in Allegheny County doing much, much better than other parts of the country have seen and other parts of the region. And then she'll introduce Dr. Weinberg, and then we'll come back and have some further comments and then take questions from the media. Dr. Bogan?
Thank you, County Executive, and hello, everyone. I know many of you want to hear about restarting sectors of our county, our economy, and our lives. Any assessment you're going to hear from me about reopening parts of the county is going to be rooted in the science, the data, and the best advice from medical and public health experts. Luckily, we have many of those here, right here in Allegheny County. As people slowly return to work, spend time with their family, friends, and neighbors, and community sites, and increase use of public transportation, we know that this virus will have a chance to spread. To keep the virus from spreading as we reopen, we all must continue to stay at least 6 feet apart, wash our hands, and wear masks when in public. But that's not how our society works. We want to be close to family and friends. We want to go to Penguins, Pirates, and Steelers games, and concerts and festivals with thousands of people. And businesses need customers to thrive. And that's where the risk is. Until there is a vaccine or an effective treatment, COVID-19 will be in our community. And if we're going to start thinking about bringing that community back together, we need to make sure we are prepared and we do it safely. Remember, this is a novel virus, and all those who have not yet been infected are still at risk of getting it when we loosen those stay-at-home orders. We don't know what proportion of our community has had the virus and therefore might be protected by immunity. But we think it's very low, no more than a few percent based on our hospitalizations in our region. Therefore, most people in our region remain at risk. Because we've done such a good job at slowing the spread here, it's important to remember that when we start to open the county a little at a time, we have to keep practicing physical distancing, hand washing, and wearing masks. And we must make sure we're prepared if the virus starts spreading quickly. When we first learned about COVID-19, we were concerned about it overwhelming our hospitals, forcing doctors to make life or death decisions about who received care and didn't. Thankfully, that never happened here in Allegheny County, and we need to make sure it never does. I've studied many roadmaps of how to reopen, and most of them have three recommendations in common. We need to have a better understanding of the spread in our own community. We need to have more testing available, and we need to have surveillance available as well. So we're making progress on all three of these, but we still have work to do. So let's start with each one. So where are we? What's our understanding of the spread of the virus in our own community? Recent data on COVID-19 in Allegheny County is very encouraging, but there is still a lot that the data aren't telling us. Daily numbers of new positive cases have been below 40 since April 6th and have steadily decreased since April 16th. This has happened even as the county started reporting probable cases in its overall counts. Probable cases are individuals who had COVID-19 symptoms and have had close contact with a confirmed case, but have not had a positive test themselves. Including probable cases gives us a better picture of the spread of the virus. The positivity rate here is holding steadily below 10%, meaning less than 10% of the tests administered come back positive. And this has even dropped a little bit in the past few weeks. However, only about 1% of our county has been tested for COVID-19. And it's difficult to make decisions about 1.2 million people in the county when you have data on only 1%. That is why the second piece of what's required from the roadmap is testing and more availability of testing. We need tests that have fast turnaround times so people aren't waiting long for their results. Tests should be available at doctors' offices, federally qualified community health centers that serve the uninsured and the underinsured in our communities, at pharmacies, drive-up locations, and walk-up locations. We also need to make tests available to more people. The number of tests administered each day in Allegheny County has gone down recently. At the beginning of the month, between 500 and 600 people were being tested each day. That number's dropped to between 300 and 400 or lower over the past few days. We don't know why the numbers of people being tested is dropping. Test sites have increased in the county. Last week, Rite Aid opened testing sites in Monroeville and North Hills that are using observed, self-collected swabs. Allegheny Health Network added sites in Braddock and the North Side recently. And yesterday, just wanted to tell everyone, we put a map up on our COVID website at the county health department that has links to all of the current testing locations. I'd like to see the expansion of observed self-collecting tests, which don't require as much personal protective equipment. Studies of these tests have had similar positivity rates to the traditional deep nose tests that have been done before. Limitations in testing have been driven by strict CDC criteria for getting testing, which prioritize those healthcare workers, people in long-term care facilities, the elderly, people with underlying health conditions, first responders, and other critical workers. This was important in the early days of the pandemic and still is in areas where testing supplies and PPE are in short supply. I hope that in the near future, testing criteria will be relaxed and expanded to allow for broader testing of anyone with symptoms. And this, of course, depends on having enough testing materials and personal protective equipment. The health department doesn't actually oversee testing in the county. Testing is in the hands of healthcare providers. However, we are working closely with our community partners in healthcare to make testing more widely available. The final factor to consider when assessing whether to reopen parts of the county is our ability to track people who test positive and their contacts. We have been doing contact tracing and following up with people in our community, as you know. We have been, that is something we're working on to ramp up over the next, as we reopen, we recognize that we need to have more of that available to our community. One of the places where our county and other counties across the country have struggled is in our long-term care facilities. Our long-term care facilities have had more deaths than anyone would like to see. And today we have with us Dr. Weinberg, who's going to talk to us about the challenges facing residents in our long-term care facilities. She is the director of Allegheny Health Network's Division of Geriatrics and the medical director of the Hospital Elder Life Program for AHN's Primary Care Institute. So we're excited to have you. Thank you, Dr. Weinberg.
Thank you, Dr. Bogan. Good afternoon. My name is Dr. Lynn Weinberg, and I'm the director of the Division of Geriatrics for Allegheny Health Network. As a geriatric medicine physician specializing in the care of older adults, I've seen the physical and the emotional toll that this pandemic has taken on my patients and their loved ones, but I've also seen amazing resilience and a strong sense of community surrounding older adults here in Western PA. So on behalf of AHN, I'm very grateful for this opportunity to say a few words on how COVID-19 is impacting seniors in our region, both those at home as well as in long-term care facilities and senior living facilities. We know from experts at the CDC that older adults over the age of 60, and especially those over the age of 85, suffer the most serious consequences of the virus. However, we know that it's not age alone that impacts how a person will respond to this infection, but having multiple chronic conditions such as heart disease, lung disease, diabetes, or general frailty is in many ways more of a risk. Due to changes in the body that occur with aging as well as chronic illness, the immune system does not work as well to fight off infections, and also older adults present with less typical symptoms and signs of many illnesses. For these reasons, those who are over age 60 and those with chronic illnesses need to be especially vigilant and follow the recommended precautions, including staying at home, washing hands for at least 20 seconds, and maintaining a distance of 6 feet apart from others. Another major concern I wanted to take a moment to highlight for seniors is the risk of social isolation. During this time, while we are physically distancing, we need to stay socially connected more than ever. Anxiety, stress, feeling overwhelmed or overloaded with information are very common emotions at this time, especially for older adults, and really we are all feeling that way at various times. For older adults, we recommend trying out technology that may be new to them in order to stay connected with their loved ones as well as their healthcare providers while they are staying at home. If this is daunting, we recommend that they ask a neighbor or a family member for help to walk them through this process. We also want everybody to be aware that senior centers and faith-based organizations may have opportunities for seniors to volunteer from home to help their fellow community members with things like outreach phone calls to others. Many of these organizations have great resources to offer for those who are in need. For caregivers, reaching out to older adults and doing frequent wellness check-ins is more important now than ever. For those who are providing hands-on care to loved ones with dementia or other physical disabilities, one may ask, how do you physically distance in that situation? And it's difficult to know how to answer that. But we like to remind everybody that frequent hand washing and even considering wearing a mask at home when you're unable to physically distance with that loved one might be important. With regard to residents of senior living facilities and long-term care facilities, we know they face additional serious challenges. Nursing facility residents with COVID-19 may not report typical symptoms such as fever or cough, or they may not report any symptoms at all. Unrecognized infections likely contribute to transmission in these settings. And the major focus for senior living facilities at this time is being prepared and proactive in preventing the introduction of the virus into these facilities. This includes restricting visitors, limiting activities within the facility, and doing frequent check-ins of all the residents as well as the healthcare personnel working in those facilities. A final note which pertains across the board to older adults is that we cannot stress enough the importance of planning for the future. Now is a crucial time for older adults as well as their loved ones to discuss values and wishes for the type of medical care they would want in the best and the worst case scenarios, and to identify a person who would help make medical decisions if needed. It's also important for caregivers to have a backup plan in place in the event that they would become ill and unable to provide support for their loved ones who are staying at home. If there are any questions or concerns about the health of an older adult, folks should not hesitate to reach out to their primary care providers. Furthermore, here in Allegheny County, we're lucky to have an amazing area agency on aging, which has a portal called the Senior Line, which is a great place to start to access information or resources in the community for older adults. Thank you again for this opportunity, and I'm happy to answer any questions.
Thank you, Dr. Weinberg, and thanks for your work with our most vulnerable population, our seniors, and in some of the facilities that they are in. Again, before we take questions, you're going to continue to hear things from the state, the governor, and Secretary Levine. I can tell you we want to open things up as much as the governor does. I know everybody wants to get somewhat back to a normal operation that we've had. But I think we all realize at this point that when we do and as we do, there will be a new normal. And that normal will have a lot of mitigation of some of the things that we've talked about. But I can't say enough about all the work that people in this community have done to keep those levels low. One of the concerns we had early on was overwhelming our healthcare facilities and our healthcare systems, and the fact that we've been able to keep those numbers where they are continues to keep those numbers, as Dr. Bogan talked about, where we are. We want people to continue to follow the rules. We can make all the rules in the world. The state can, and Dr. Bogan and her team and the county can, but unless people are cooperating, unless people are really doing things on their own and being cooperative, none of those laws or none of those regulations are going to help keep everybody safe, which is the goal that we want to continue to have. We're going to continue to see guidance coming from our state, from Secretary Levine and Governor Wolf, and the things that they're doing. We want to continue to have that happen. We want to thank our friends at the federal level, our federal representatives. Continue to help us with some of the resources that we're going to need. We're going to continue to ask, and I know Dr. Bogan has said this, and others around the country have talked about testing. We need to continue to ramp up our ability to test so that we know if these numbers are as good as we think they are. As she indicated, around 1% of the folks in this county have been tested. That's not enough, but actually compared to some other places around the state, it's actually more than the others have had. So we want to continue to advocate from our friends at the state and federal level to continue to help us here at the local level. There's two other items I want to talk about today that are important. Two functions we need to do, but we can do them in a safe manner. And one is the census. We have to go through that census process right now. You can do this online. You can do this with physical distancing, not typically where we would have somebody knock on your door and take all the information from your household, but we can do it online. And I'm proud of the fact that right now, while in the United States, 51% of the people have responded, in our county, we've had almost 56% of the people have responded. So we want to continue that. Our success rate or our goal back in 2010, 10 years ago, was 71%. We certainly want to exceed that goal with everybody's cooperation. So I want to thank you. Let me just give that out again, where you can go online and do this, and that's www.2020 census.gov to complete your census. Or you can call 844-330-2020. And now obviously we also have language services for other non-English speaking people. The second thing that we announced late last week was is the election. We have an election coming up. Democracy is something we're not going to stop moving forward, and give everybody their right to vote for who they want to represent them at various levels of government. So last week we announced that we are going to be mailing an application for a mail-in ballot to every single registered voter, Democrat and Republican, here in Allegheny County. Those should be going out over the next couple of weeks. I can tell you we've already received over 87,000 applications. As of earlier today, that was the number, and over 30,000 of those have been processed. 15,000 of those have already gone in the mail, and more are going out every day. So be looking for your ballot or your application if you've asked for one. And then obviously with that, you send that application back in. We're going to send you an addressed envelope that addresses to the election department with the postage paid. So you don't have to buy the stamp, you don't have to buy the envelope, you don't even have to find the address. Is all going to be on there for you, and we're going to make that as easy as we can. If you want to apply right now and you don't want to wait for those next couple of weeks, you can go on the website, which is AlleghenyVotes.com. You can go on that right now and submit your application online. And again, we say this every week, but we cannot say it enough. For those first responders and those folks that are on the front line taking care and providing the services that we have during this COVID-19 pandemic, we can't thank them enough. Grocery store workers, food service workers, first responders, everyone in the essential business that are dealing with the things that we're dealing. And with that, let's open it up to some questions that we might have from the media. Amy?
So as a reminder for our speakers, two things. One, we have an amazing sign language interpreter, but we're all talking very, very quickly. And even though she's good, let her take a breath, please.
She is good, by the way, so we're lucky that we have her, and she's got a lot of practice over the last few weeks. Thank you.
And second, when responding to the questions, please make sure that you go to the podium and the microphone. The first question is from KDK TV. We are hearing more and more stories, the most recent out of California, that COVID-19 was present in the population in early February or even January. Is there any evidence that is the case here, and how would we know?
That is an important question. And I think, as you all know, we live in a community where a lot of research happens because we have large research institutions. So there are some data from studies that were being done that they went back and tested respiratory samples from old data from January and February and looked specifically if we had COVID-19 in our community. And those were people who were sick and showed up with respiratory illness. And those came back negative. So I think I feel very comfortable saying we did not have community spread in our community in January and February in our region.
The next question is from the Observer reporter. You touched on this briefly in your remarks, but are there adequate COVID-19 testing and supplies available in Allegheny County?
That's a complicated question. Again, we have lots of people doing testing. We have testing being done at hospitals, in community sites, and what I hear is that there is still some challenges in getting some supplies for the nasopharyngeal swabs. Those are the deep nose swabs, and some of the reagents to run those tests. But my understanding from the people who are doing those tests is that it's getting better. There are, again, Rite Aid opened a test site where you use a swab that goes into the front of the nose rather than the back of the nose, and it is you do it yourself under observation. And there are other test kits available that don't require those specialized nasopharyngeal swabs either. So, and those I think are going to be coming to our community more and more, which will free up our ability to do more testing and not be reliant on the supplies that are limited.
This question is from WESA. Have you gotten any indication from the state that Allegheny County could be among the first areas in the state to open up, given the relatively low case count?
Yeah, that's also a very good question, and we've had certainly discussions with our friends at the state, and because of what we have seen here in Allegheny County over the last month and a half, we do think that there may be some additional relaxation of some of the things that are going on in other parts of the state. I think the governor's probably going to be making announcements later on today and maybe later this week to talk about how different parts of the state in different regions will be opening up differently. But regardless of how that happens or how we are permitted to with respect to state regulations, we still want to follow these experts who have really given us great guidance, so that just because we've been given some relaxation of those regulations doesn't mean that all these other mitigation practices that we've been doing, they still need to be followed.
This question again from KDKA TV. We see case numbers each day. What is the likelihood that due to the lack of widespread testing, we are only seeing the tip of the iceberg?
So we probably are only testing, we have only been testing people who meet very strict criteria, people who are elderly, people who have risk factors, healthcare workers, and for weeks now we've been telling people who are sick but don't meet any of those risk factors to stay home. So we know that there are people who have had this infection who we've never tested. So even if you estimate, for instance, we've tested almost 13,000 people and only 10% of those have come back positive. So you could make some assumptions or some guesses that maybe for every one person that tests positive, there's 10, 20, or 30 people who haven't tested positive who are out there. We don't know that exact number. But again, even if you do that, we have had very few overall positive cases. And again, probably way less than 5% of our community has had COVID-19 already.
I'm going to combine a few questions together. We have several questions, including from Public Source and KDK Radio, asking questions about contact tracers. Is the county considering hiring new staff or assigning staff to work as contact tracers so that when we do open up, there will be enough workers to isolate the contacts of new cases? Related to that, how many contact tracers do we currently have? And the CDC has recently announced that they're making funding for contact tracing experts to health departments available. Is that something that Allegheny County could potentially receive funding or would pursue it?
Sure. Let me go back a little bit and explain. So we at the county have been doing case investigation. That is when somebody tests positive for the infection, we call them, we go through their history, we find out who their contacts have been, and that we follow up with those people to let them know they may have been exposed and they need to stay in quarantine. And we have been doing that very religiously here. As we have closed down our society and people are traveling less and out and about, our contacts, the contacts we have had to reach have been reduced, right? Early on in the infection, every case had lots of contacts, but now we're seeing much less of that. When we start opening up society again, we're worried, of course, that people will be out in the community and have more contacts, and we would need an increase in contact tracers. That is, people following up both on the cases, those case investigators, and more contact tracers. We have been working on our numbers to figure out what that would look like in our community, and are developing a plan to figure out how many people we need to hire or to work with other agencies who can help us with that, but that is under development. As you question about the CDC funding, we have discussed, we've talked to them, but we don't have any answers yet about funding from the CDC for that work.
This question is from KDK Television. A COVID-19 survivor said that he'd be willing to offer up his plasma if it could help others, but he doesn't want to put himself at further risk by going to a hospital, and he also has no idea who to contact to see if anyone would like it. What should he do?
Well, we are grateful to hear about that. We're thrilled that you're recovered and doing well. We had Dr. John McDyer on last week as part of this event, talking about his work with convalescent plasma. And information about Dr. McDyer's work is on the county's website. People can also go get information by emailing I'm going to try to read this. It's C, the number 2, P, the number 3, upmc.edu or calling 412-647-9779.
The next question is also from KDK Television. Should COVID positive patients in an elder care facility be removed to a centralized facility just for COVID patients to protect everybody else?
I don't think we have the capacity to do that at this time, and I'm really, would you like to address that? I'll have Dr. Weinberg come in and talk about that.
I know there have been some discussions about that have occurred locally about if there's a potential surge in our hospitals or in skilled nursing facilities around the region that might be a potential solution. As of now, the recommendation is for facilities to try to cluster residents who either have confirmed or possible cases on one unit or one floor or one wing of the facility and dedicate staff to that area of the facility. And that's really the practice that we should be seeing as of now.
I have a related question to that as well. Families with healthy relatives in nursing facilities want to know if they should remove them, if possible, for their safety. Can you address that?
We've seen some of that happening, and I know this is a really difficult time for residents in long-term care facilities to not be able to see their families and their loved ones. So we have seen some residents of those facilities transition to home, and I think that has to be a really individualized and personal decision among a patient and their family about whether or not they can manage those care needs at home and kind of weighing the risks and the benefits of that situation. But that is certainly always an option to consider.
This question from the Post-Gazette: how will counting probable cases and probable deaths help the county in responding to the pandemic? How do you assess a probable case? Is it decided upon just by a member of the contact tracing team, or does the county also use an algorithm to determine a probable case?
So there is a probable case definition that is put out by the CDC and the Department of Health, and that's the guidance that we follow as for a probable case. Again, it has to be someone who is been in close proximity to a known case and has symptoms consistent with the disorder. Knowing that number, again, gives us a better idea of household spread. So within a house, how many people or a household are getting sick. It also gives us an idea really about how many people we have here who've been exposed. So again, we only started counting probable cases, I think, last week, if I remember correctly. And so those are newer data than before that.
This question for the county executive: will the county appeal to the state to try to reopen when it thinks it should, or will the state tell us when we can reopen?
Well, it's a little bit of both. It's a conversation that I certainly have and we have with our friends at the state, and I can't say enough about the level of cooperation that we have gotten from Governor Wolf, Secretary Levine, and their whole team, Secretary Davin, Secretary of Labor and Industry, et cetera. They've been very, very cooperative. So, these things are, obviously changing as we see our numbers continue to, do what we want them to do. And that's been positive. Gives us some optimism that things can probably open up a little more. But the other thing on the other side of that is really important, because if we do open some things up and we start to see those numbers start to go up and spike, the positive cases, then you have to go back the other way. So so a lot of our experts have been talking about that as we get into the fall. There could be a second wave, or there could even be a wave if we open up too soon. So this is one of those areas that's going to take a long time for us to continue to do the mitigation and the physical distance that we've talked about until there is a vaccine or a treatment or a cure. And until that day comes, all these other things are going to have to be in place.
So a follow-up question for the county executive as well. From KDK Radio: what do you see opening up first? Will you make a recommendation to the governor regarding that, and when might you make that recommendation?
I think we'll probably see things that can be done where you don't have a problem with physical distancing. Certain office operations I could see where you are able to keep a limited number of folks in an office facility Obviously, certain types of retail have been open, and you may see more of that. But again, I think on a very limited basis where you limit the amount of people that are coming forward into a facility. So those are the type of things. But I think anywhere you have large crowds, where we used to have large crowds, or you'd have a number of people coming together, I think those things aren't going to be opened up anytime soon. I think you probably are going to be very limited in the type of operation where you almost have to have physical contact, and physical distancing is difficult. So I think some of those operations are going to change. I think around things like manufacturing and office operations, I think doing them in shifts so that you don't have the whole office complex coming in the traditional 8 to 4 or 9 to 5 operation. You may have to, instead of coming in every day, come in 1 or 2 days a week, and maybe come in different shifts. So I think there's going to need to be a lot of flexibility, and I think as the community continues to show good numbers and good results, I think more and more things can open up.
This question from Public Source: does the county support our local healthcare system's decisions to expand the procedures that they're currently conducting at their facilities?
So the question is about whether we support the decisions of the thing. So, there are good guidance that have been put out about what you have to do to be ready to open things up in healthcare facilities. You have to have adequate testing, PPE, personal protective equipment, and again, the care that is necessary and has been delayed does need to be done at some point. And that is really, we're leaving that up to not leaving that up, but they're hopefully following the guidance of the state on that, and doing it as safely as possible.
Two related questions from the Tribune Review. UPMC recently announced that it's going to start testing all patients, symptomatic and asymptomatic, and AHN opened new test sites on the north side and Braddock recently. How is the county health department going to be using this new data? And does having those test sites in those locations yield any new insights about how COVID is impacting communities near those sites?
So the more testing we have in the community, the better. And it increases access for people who may have not had access to testing before, so that's great. All of those data get reported into our state reporting system, so we have access and can look again at our rate of positive tests and where those tests are coming from. So that all adds to our information on how we plan and make decisions. So more testing, I think, in our neighborhood, the more we can have, the better it is. Again, testing has been fairly limited till now, and I think is just beginning to open up. And I hope in the next week or two we'll really see much more wide availability of testing, so we can really understand how much COVID-19 is out there among people, and not just among those really high-risk groups that we've been testing till now.
This question is from WESA. In other cities, the number of fatalities among Black residents has been disproportionately high. What is the county doing to make sure the Black community here has the resources it needs to protect itself from COVID-19?
Well, like all communities, it's important that we get the message out about physical distancing, about wearing masks in public, and about hand washing. And that goes to every community in our county. Is important that we get that out. I recognize that across the country there has been disproportionate impact on our Black communities, and we have been working with leadership in our Black communities to really think about better ways to get the message out. We're also trying to improve access to testing in those sites so that people can walk and not have to take buses, because we don't want people on public transit who have COVID-19. We held some listening sessions with the Black community and with other communities recently, both our immigrant community, our Latinx community, our clergy, and we're working on compiling their recommendations so that we can address what they have suggested to us would improve access to information in all of those communities.
This question also from WESA. a lot of coronavirus transmission occurs within households, and it's hard to self-isolate when you live with other people, especially in small homes. Are there any locations where people infected with the virus can go to isolate and convalesce outside of their homes?
Yes, at this point, the county is not providing dedicated sites for that purpose. But we have information on our website about how best to physically distance at home. I know it's challenging. We do ask if someone is sick in your home that you should help him or her with the basic needs, monitor their symptoms while also keeping as much distance as possible. We know that's easier in some homes than others. If there's space, the sick family member should stay in a separate room and use a separate bathroom. But again, for many people, that's not possible. In that case, make sure you clean bathrooms frequently and that, if possible, to wear masks, both for the person who's sick and for the caregiver who's taking care of them. Try not to share dishes, spoons, cups, things like that. And again, cleaning surfaces as much as you can.
Two questions again related to contact tracing, one from WSA and one from the Post-Gazette. In the last 7 days, Allegheny County has reported 184 new COVID cases. Approximately how many of these cases were uncovered through contact tracing? And when someone is contact tracing, how far back do they go to trace the people that a positive person may have come in contact with?
So we have, I think, reported 15 cases from contact tracing. So that is, we called a case and they reported other people sick in their homes. But I suspect that number will increase a lot as we are working with other teams to really go back and find out about household contacts. I forgot the second part of the question.
How far back?
Oh, how far back? So it depends on when we go back to 48 hours before someone felt ill, because we believe that, based on the best data out there, that you can start transmitting the infection up to 48 hours before you have symptoms. So that's how far back we ask those questions.
This question for the county executive. You just referenced shift work and proposed that might be a way for people to return to work. Does the county have a plan for that, or what is the county's current plan for how its own workers will return?
Well, our various directors have worked with our employees to make sure that they, follow the guidelines that are put out there to keep our employees safe. I guess we'll have to do it on a case-by-case basis to see how many folks are available, how operations can operate. We do see an awful lot of not only our operations, but other operations that are trying to do as much remotely, as much at home or in other places without having to come in contact with people, to keep the physical distancing where we can. Also knowing that, obviously some of our facilities, that becomes very challenging. Things like the cane that we talked about earlier, things like the jail, some of our caseworkers and human services who have to go out and be in contact with their clients.
This question is again from WESA. A new report from Harvard suggests that to reopen, we should take a target isolation approach, which includes testing asymptomatic people who have come into contact with people who have tested positive and asymptomatic people who work in fields such as healthcare. Are there any plans to deploy such a testing regime locally?
That is a really important question, again, as we think about reopening. I understand, I think that UPMC is doing testing for people that don't have symptoms currently who are coming in for procedures. So that's happening. We currently don't have the ability to do that, but there are two limitations. One is we don't know when the best time in the course of an illness is to test somebody who may be asymptomatic. So if you get exposed on day 0, should we be doing the test on day 3, day 4, day 5, day 6? When is it best to test for that? And I think that data will be coming shortly, but we don't yet know it. And it may vary by the type of test you obtain. So it may be that if you use an oral swab or the swab that goes in the front of the nose, that may be different than if you're using a test that goes deep into the nose. And so as those data become more available, I think that is something we should certainly think about. We don't have those plans yet because we don't really know that detail of when would be the best time to test. But again, if we open things up and we have somebody we know is sick and we have contacts who were exposed, and we know when the best time to test is, we should be thinking about that in the future. It's just not available now, but I assume in the future it will be. I just don't know when.
This question from the Tribune Review. We've been getting a lot of questions from readers about how many people have recovered from COVID-19. Is that data that is is that data that is available, and is that information something that's possible to measure?
I think it's really important information, and we haven't been able to get a good handle on that, but we're working on that by calling our cases back and figuring out who's gotten better, how long it's taken them to get better. So I hope we will have that data in the future. We definitely don't have it available right now.
I have one last question for Dr. Bogan and then one last question for the county executive before closing remarks. The Tribune Review is asking if there are any details available about the 42-year-old who died, including whether they had underlying medical conditions.
I understand that the young person who died did have some underlying health conditions.
And this question from the Pittsburgh Business Times for the county executive. What advice would you have for businesses as the reopenings start, and how they should make the decision to stay closed, reopen, or reopen with stricter measures? What should businesses be doing now to prepare?
I think a lot of what businesses should be doing is really reviewing in detail the guidelines that the Pennsylvania State Department of Health put out that took effect Sunday. I think those mitigation strategies and those mitigation regulations are very, very important. You may even want to go beyond that in each specific instance. So I think in a lot of ways, your employees and your customers and the people that you interact with are going to have a lot of input as to how that can occur as well. So I think a lot of it's going to be people being obviously very flexible in how operations, which formerly did maybe things a certain way, are going to be done in a different way. So I think we just need to be flexible and follow some of the guidelines that we have from our medical professionals, Dr. Bogan, Dr. Weinberg, and the folks that are here. Before we wrap up, I'd like to ask Dr. Weinberg to come up and maybe finish and say a few words. I want to thank her for the work that you're doing, the work that your organization is doing, taking care of our seniors, our grandparents, our parents, our most vulnerable population that really has been affected by this more than anybody. So Dr. Weinberg, please, and again, thank you.
Thank you. Thanks again for inviting me. And I just want to remind everybody to take care of your neighbors, loved ones, family members. If there's ever any concerns, we as primary care physicians are available no matter where your primary care physician is located. Our offices are open. We are doing a lot of phone calls, video visits, outreach to our patients, and working hard with our leaders here in Pittsburgh and the county on those testing strategies and making sure we're mitigating the risk for all of our patients across the board. So thank you.
Dr. Bogan, did you have any closing remarks? And then we'll close it out.
I just want to reiterate how thankful and grateful I am for everybody who's chipped in and really helped across our county. People have been working in a team way across our county, from foundations, hospital systems, people calling and volunteering. I get a couple of emails a day offering volunteer services. People are incredibly generous and kind and patient, and I really appreciate that. I recognize people have been home a long time now and they are anxious to get out, but we need to do it safely. And so I appreciate your patience as we work through the strategies to do that as safely as we can. And thank you, and stay well.
Thank you, Dr. Bogan, and let me also echo the words that Dr. Bogan and her team have talked about. We are so fortunate in this community. We went from being known as a manufacturing giant to an eds and meds giant, and we are. And we're so fortunate, certainly at this time, that we have such medical and health expertise that until this occurred mostly worked in anonymity. And now people like Dr. Weinberg, or we're getting to meet them and find out some of the work that they do to keep us safe. During this pandemic, the level of cooperation, as Dr. Bogan said, the people who are donating things, the people who've offered their services, from businesses to our universities to our foundations to community leaders to everyday citizens, all cooperating. As we said when we made that video over 6 weeks ago, we talked about coming together by staying apart, and that's what people of this region have continued to do. And we ask you to continue along those lines. We've done, I think, better than a lot of us anticipated that we've been able to do back in mid-March when we began this process. And I think we want to continue to live up to the work we've been continuing to do to protect our family, to protect our community, and protect ourselves. So please continue on what you're doing. And again, Dr. Weinberg, thank you, and AHN, UPMC, Pitt Med, we're so fortunate to have that. Thank you and God bless.